Hi there and welcome back. Let's review drugs and individual life underwriting. Although every company will rely on their own research, their own data, their own claims experience, however, there is a general consensus when it comes to drugs in life underwriting. So, generally, it is considered that for any individual to be considered for life coverage, he or she must have been currently involved in a normal occupation with job stability. There should not be any driving or alcohol criticism and or any financial questions or concerns, and last but not least, the personal environment must be stable. Any indication of drug abuse should lead to even more diligent underwriting than usual of the applicant's lifestyle. Abusers of drugs frequently abuse alcohol as well, and cross addiction is common, and that's the reason why we took in the prior sessions alcohol, and in these sessions we are trying to review in brief drugs and how to underwrite. Let's talk about abuse, dependence and addiction. Abuse may lead to physical and or psychological dependence with withdrawal symptoms on discontinuance of the drug. Dependence is a function of the amount of drug used, the duration of use, and the idiosyncratic nature of the user. Drug addiction is a chronic disease characterized by drug seeking and use that is compulsive or difficult to control despite harmful consequences. The initial decision to take the drugs is voluntary for most people, but repeated drug use can lead to brain changes that challenge an addicted person's self-control and interfere with their ability to resist intense urges to take drugs. These brain changes can be persistent, which is why drug addiction is considered a relapsing disease. People in recovery from drug use disorders are at increased risk for returning to drug use even after years of not taking the drug. So obviously that requires us to take a moment to explain what is relapse. So let's review what is relapse. Relapse is the return to drug use after an attempt to stop. Relapse indicates the need for more or a different treatment. So the question comes, how it affects the functions of the individual if he or she keeps using, or let's put it this way, the long-term use of the drugs. So the long-term use of the drugs affects the functions that include learning, judgment, decision making, stress, memory, and behavior. Despite being aware of these harmful outcomes, many people who use drugs continue to take them, which is the nature of addiction. How about risk factors? No single risk factor can predict whether a person will become addicted to drugs. A combination of genetic, environmental, and developmental factors influences risk for addiction. The more risk factors a person has, the greater the chance that taking drugs can lead to addiction. How about the treatment? Drug addiction is treatable and can be successfully managed. Drug use and addiction are preventable. So, what are the requirements as we underwrite cases? What requirements we would be ordering? So that would include full blood profile, make sure you have the HEP panel, pay close attention to LFTs because there could be alcohol as well, MVR, motor vehicle report, driving history, medical records, phone inspection, pyramid exam. Make sure you get on drug cases the drug questionnaire, full drug screen and RX check. And ultimately, how do we underwrite? So first and foremost, correlate with the prior session and see if you are dealing with just drugs or you are also dealing with alcohol issues or alcohol concerns as well. And if so, correlate with the prior session and start with alcohol questionnaire as well. In addition to that, if you are dealing only with the drugs, let's say if that is the case, then depending upon the drugs, are you dealing with opiates, say heroin, morphine, methadone or cocaine, coke, crack, etc. And depending upon your underwriting manual and the company specifics, likely it would be in the range of RNA or risk not acceptable for 2 to 3 years. That is typical in a majority of the life underwriting manual. So what is the take home message? The take home message, whether we are dealing with alcohol or whether we are dealing with drugs, the take home message is this: proceed with caution. Okay, let's take a quick break and we'll see you soon. Take care. Bye now.